move on to our next presenter, Dr. Anurag Saraf from Harvard. He's going to be talking about teaching, mentoring in radiation oncology, the TEAMRO, a ROECSG GME multi-institutional pilot study on teaching mentorship skills to residents.
Hi, everyone. So my name is Anu Saraf. I'm a PGY4 resident here at the Harvard Radiation Oncology Program. I want to thank the group and the committee for allowing us to present our work here today. This is a work in progress of a multi-institutional study coming out of the GME working group. So these are our disclosures. So this actually kind of builds on a study we presented last year, but basic introduction is mentorship is an important aspect of academic medicine. As we all know, formalized mentorship has been associated with increased satisfaction and mentor-mentee experiences, earlier development of preceptor skills, as well as positive long-term impact, including higher job satisfaction and improved patient communication skills. However, mentorship skills are not commonly taught, particularly in early career. One area where we were interested is we noted that residents commonly interact with medical students on rotation. However, they don't consistently view themselves as mentors during that interaction. I'd like to highlight one study that was done actually by one of our moderators, Dr. Franco, who presented her work at a previous ROECSG, where we do have data that suggests that mentorship, formalizing a resident-student interaction into a formal mentorship relationship, can pay off significant dividends and benefits to both the resident and the student. So based on that background, our hypothesis is that a formalized resident medical student program can improve resident mentorship leadership skills and confidence while further developing a mentorship culture in radiation oncology residency. So this is the study design. Primarily it's focusing on the resident for this pilot study, but what we're aiming to do here in this multi-institutional single-arm study is to develop a program with two phases. First, a mentorship curriculum, which requires about 1 month of commitment for the resident, followed by the mentorship program, which is formalized during a medical student rotation. We also implement some follow-up to really assess the benefit after the relationship itself. Here's a little bit more detail, but essentially asking the resident about 1 hour a week over a 2-month commitment. First, where we do mentorship curriculum, going through principles of mentorship as well as practical skills. And then the mentorship program, where throughout a medical student rotation, we would have the resident mentor formally interact with the student, even outside of clinic, to go through a lot of these elements that can help promote mentorship. Here's a little bit more information on the curriculum. Appreciating in this pilot study, the great time commitment that residents have outside of clinic, trying to keep it as low weight as possible for implementation in the pilot. And here's the mentorship program, which through the multiple different groups in the working group, we've come down to some basic elements that incorporate the medical student sub-I rotation as well as mentorship skills. So some suggestions include first week talking about principles of radiation oncology, second week going through evidence-based medicine and capstone presentation, and the last week we're really focusing on career counseling. Assessment, we're going to first utilize a needs-based assessment to really formalize what are the needs of residents for mentorship skill. We'll also plan for a qualitative assessment through focus group and semi-structured interviews, and finally have a pre and post intervention survey for the residents who complete this program. So significance overall, we hypothesize that this formalized mentorship curriculum may improve mentorship for residents themselves and really enhance their own resident to faculty mentorship relation. And secondly, we feel that mentorship skills and experience may empower residents in their overall career development. I'm excited to be able to present some preliminary results of the need-based survey we've done at our single institution. So first we asked residents, how confident do you feel serving as a mentor? And you can see that 3% felt confident. So there's a large number that, while they didn't necessarily think of themselves as mentors, did feel confident. But there's also a minority that we feel we can help with. Secondly, we asked specific questions related to mentorship, whether residents felt comfortable when interacting with med students. So you can see that residents overwhelmingly did feel confident providing positive recognition and constructive feedback, however, did not feel as confident diagnosing and assessing students' developmental needs. So in further studies, we'd like to explore what are some of the reasons for these lower scores, and whether, number one, residents can be taught, and number two, really creating a developmental mentorship network within a residency where faculty may focus on certain skills and residents can focus on other skills. And here's a little bit more a list of we surveyed residents on multiple different mentorship skills through a previously validated survey. And on the top, you can see the 5 highest ranking skills. And on the bottom, you can see the 5 lowest ranking skills that residents felt confident. And some interesting patterns come, especially in the benefits, where residents felt really comfortable establishing relationship on trust, active listening, and building confidence, which are really important skills for mentors. So future directions, we're hoping to be able to take this curriculum and program and really expand it into multiple institutions to be able to find how we can standardize this relationship of interaction that already is happening. And we also have other questions that are coming out of this pilot. For example, number one, can we expand this to mentorship of junior residents to senior residents? And number two, can we expand this to preclinical students, not just sub-I students, and see their impact on career development and interest in radiation oncology? So we are actively opening for this academic year. We have IRB approval at our institution. And so if anyone's interested, we'd love to have you on board. We are having a trial planning meeting. Actually, it's probably going to change to the week after June 9th. As many things are, it's constantly evolving. But if you have any questions or any interest, feel free to reach out to me. Here's my email as well as my Twitter handle. I love to talk to you more about it and see if there's any interest. And here at the end are just some acknowledgements of the GME working group, where a lot of work has been done throughout the entire group, as well as the different institutions that are already interested, and a little bit of grant funding from our own institution. And these are our references. So that's it. I'm happy to answer any questions.